Here in Sinkoro in Mali, they're having a party. It's been organised as part of NGO Sightsavers' Mass Drug Administration Programme, which recruits community health workers to prevent and treat blindness from two neglected tropical diseases, Onchocerciasis or river blindness and Trachoma.
Sightsavers began its activities in Mali in close collaboration with the Ministry of Health, and the activities we undertake are particularly activities against onchocerciasis. We also fight against trachoma and cataracts. That is roughly the main thrust in Mali in regard to the fight against blindness.
The main aim of Sightsavers in terms of health is to prevent and cure avoidable blindness. About 75% of blindness is completely avoidable. The leading cause of blindness is cataract globally, but in Africa we have blinding, what are called neglected tropical diseases, one of which is trachoma and the other is onchocerciasis, or also known as river blindness.
In 1987, the village was almost abandoned due to the severity of river blindness, but because of the Mass Drug Administration Programme, it's now under control.
The advantage of the collaboration with Sightsavers is it helps reduce the number of patients. Thanks to the drugs that we receive, we are healthier, I would say. If Sightsavers continues to provide us with medicines, it will probably eradicate the disease. We're counting a lot on this project. At the moment, we are satisfied.
The drug is donated by Merck. It's donated to as many people that need it for as long as is needed. The cost is to actually get the drug from the port of entry to the community and then to sensitise the community and to educate the community about the disease. So it's empowering communities to distribute and control a disease. The exciting thing now is that disease that can be eliminated. The elimination of the transmission can happen just through the distribution of this drug.
Trachoma is also a severely blinding disease, affecting mainly women and children.
Onchocerciasis is treated with Mectizan, and trachoma is treated with a drug called Zithromax. And Zithromax is donated by Pfizer. It's treated by a strategy called SAFE, S-A-F-E. S is for surgery, A is the distribution of an antibiotic, and then F and E, it's face washing and environmental change. And if you cover all of those four areas over a period of about 5 years, you can reach the elimination of blinding trachoma.
Our first job is to educate the public about the problem of blindness. We identify the real needs and management problems of blindness. We decide the interventions that need to be made, and these interventions can be minor surgery or the distribution of drugs such as ivermectin and albendazole, and often we're also evaluating the work of the programme.
In situations where Sightsavers aren't able to prevent and cure blindness, they work with a local partner, the Mali Union of the Blind, or UMAV, to rehabilitate blind people back into their communities.
We go and see the head of the village and pass on our message that there is an agent to help with the rehabilitation of blind people back into society. We increase awareness and we recruit volunteers. Some people join straight away, other people hesitate before joining in. We work with them. Our first objective is mobility and orientation, which is really very difficult, and there are two kinds. The mobility of a blind person with a sighted guide. We walk together and gesture to help the blind person and guide his steps. And after that we come back with a cane to guide the blind person and help them find their way.
We work by raising awareness through the media, health centres, through talks and discussions with the communities. There are also the visits and different links we make. We work mostly with local radio stations, we do interviews and we raise awareness through these stations. We say on this date, in this place, there will be this event. We've done several events that way. The programme is supported by Sightsavers, but without the community it wouldn't work.
We are in the business of supporting countries to develop services for blind people, by which we mean specifically health services, but also education, and also helping them to be more integrated into their community and to fulfil their potential. So we're an organisation that is about working with and through other people.